Hello, welcome to season 2 of the Public Health Spotlight podcast. I'm River Simmons, co-host, and today I'm joined by Helen, who is DPH here at Trafford. Great to have you, Helen. Firstly, can we get started by talking about your journey and career path to getting to the DPH role here at Trafford?
Thanks. So I've been Director of Public Health at Trafford since May 2023. I'd worked at Trafford since 2014. I joined as a Public Health Registrar in my last year. Before then, I'd done the Public Health Training Scheme, so I joined that in 2009. The placements at Nice, at Stockport and at Manchester. Loved it. Brilliant opportunity and experience. Before joining the scheme, I'd done a range of public health roles. So I'd worked in London, I worked in Enfield, Barnet, done research, project officer roles, and then I've come back to Manchester, working in Tameside as public health intelligence. I'd kind of got to that point knowing that I wanted to be DPH, so I joined the scheme. I've always wanted to be a DPH, something I've always wanted to do, but I didn't really apply until I was ready. I had the opportunity during the pandemic, which is something I don't think any of us were prepared for in terms of being ready for it. There's lots of preparation in place, but I did 6 months acting into the DPH role here. The first day I was DPH, we were the highest rates. We had the highest rates of COVID in the country. So you can imagine waking up thinking, oh, brilliant, I've got to where I want to be. And then like the BBC News is like Trafford at Greater Manchester. So that in itself it was a real challenge. I did 6 months in that role. And my DPH came back into role following that. And I just knew at that point that I was ready to be a DPH. But what I'd say is I've worked in public health since doing my masters. I did my masters in Birmingham, 1998. Went on to run an off license after them actually for a little bit, and then went to London to start my career. It was about, I think it's really important to have that level of experience and to that breadth of experience as well before jumping into the DPH role, because it's quite challenging.
Yeah, absolutely. I can agree more. And I think having exposure to different parts of the system and different parts of the country really helps you to have that holistic approach. Speaking more about Trafford then, what are some of the kind of key aspects that make you so proud to work for Trafford? So it's unique, isn't it? It has areas of affluence and also areas of deprivation. What to you makes you proud to lead Trafford?
So we're surrounded by some of the greatest sporting assets in the world. Just up the road we've got Man United, which will in the next 15 years go through a huge regeneration, which is really exciting for us. Just on the other side of where we work is the Lancashire Cricket Ground. Again, huge opportunity working with them. We've got Sale Sharks, we've got Altrincham Football Club. There's lots and lots of sporting opportunity. We've also got Trafford Centre, and Trafford is home to the very first purpose-built industrial estate in the world. I think it was actually Trafford Park. So it's really diverse. So in terms of opportunity, there's huge opportunity in Trafford. So we work with our partners really positively. Trafford's got great community in terms of working directly with our community groups and in our neighbourhoods. But I think one of our challenges, but actually it creates opportunity, is the different neighbourhoods. So we work across Trafford, split into 4 neighbourhoods. So in the north, it's very much kind of the city centre area. It's very diverse, has high levels of deprivation and poverty. If you go to the south, it's very affluent, big, rambling houses, lots of green space. So that in itself brings quite a different approach to public health. You have to work differently depending on which community we're in. But again, that's exciting. It's different. And there's lots of different needs across the population as well. So the way I work with my teams, we're split across the neighbourhoods. So my office are working in the south at the moment. They're very focused on dementia and alcohol in particular. In the north, it's about getting people moving, getting people vaccinated, supporting our community groups to do that at grassroots level. So that's some of the really positive side. The VCSFB community, so the voluntary sector, is really flagging in Trafford. We've got some brilliant partnerships. And being part of GM as well, Greater Manchester has, lots of positives around it. Working really closely with Greater Manchester Combined Authority and the ICB as well. So really a brilliant place to work, I would say.
Yeah, absolutely. And you highlight brilliantly there some of the key challenges, but also the opportunities. And one thing I actually wanted to ask you about was how you kind of tackle the increase on a day-to-day basis of having such a diverse population, but also the changes in how that population and those figures are, because obviously you mentioned, Manchester United Football Club or the other sporting clubs here. So your population on day to day can kind of change. How do you kind of tackle that?
So we use our public health intelligence a lot to understand what our resident population looks like. So we make sure we're meeting their needs. But I think a good example of that is during the pandemic, we were working with some of the companies on Trafford Park and the big employers, that what we found out was that it'd be like the equivalent of a whole city coming in every day and going out again. So I think understanding what that looked like and where our people who were working in Trafford came from every day. So they were coming from Rochdale and Oldham, real movement in and out. So I think the DPH is in Greater Manchester. So there's 10 directors of public health in Greater Manchester, and we work really closely together. We're all part of the Greater Manchester Public Health Network. So we often pick up the phone to each other, or we meet every fortnight to talk about key issues. So some of these things are stuff that we would discuss together, or we may have working with the Greater Manchester Population Health team as well, some shared codes of work that touch everywhere in Greater Manchester. This is smoking. Making Smoking History is, I think it's an award-winning programme of work around smoking. Smoking rates have dropped significantly in Greater Manchester, and particularly a really good area of work has been made smoking at time of delivery. So when women are going into hospital to have their babies, are the number of women who are smoking during pregnancy has dropped as well. But that's because of a GM approach, which all work together with the population health team to achieve that.
Lovely. And the GM approach is something I do want to discuss with you. But just before we move on to that, what's one project or initiative that you've got going on at the moment or have had recently that you're most proud of in relation to Trafford?
So can I cheat and ask for three? So one which is very local to us in Trafford is antibiotic stewardship. So it's quite a niche thing, but it's so important for public health and long-term health. So the use of antibiotics is a real concern. We're seeing an increase in antibiotic-resistant conditions. We recently started bringing about antibiotic-resistant gonorrhea, for example. So our sexual health services having to manage these situations day in, day out. We have people in residential care homes who are, struggling in terms of being able to take certain antibiotics because they are resistant. And then, that can be a really challenging position to be in, really, for healthcare workers trying to look after people. So Trafford, for a long time, I think for over about 5-6 years, we were the highest in the country for broad spectrum antibiotics. So that kind of giving the prescription for blanket antibiotic. So for a long time, and we were seeing high levels of C. diff infection and lots of other things. So public health, our primary care colleagues and others kind of all got together to try what we're going to do, how we're going to tackle this. So we've got a system-wide approach. So that includes education. So we had a GP registrar who's fantastic. She dug out all the data for each practice. We went to speak to the practices with the highest levels of prescribing, particularly thinking about those in our more deprived communities as well. She looked at data, really interesting data around GP burnout, which showed that the practices that had responded to the BMA GP burnout had the highest rates of antibiotic prescribing as well. So there's an element there of compassionate working, isn't there, to recognise that you've got to work for pores who are exhausted. So what approach do we need to take? So we did some online education sessions, talking to GPs directly, sharing their data with them. We did some work with care homes about when to dip urine. It's all very specific. When to dip urine, when not to dip urine. How to have conversations with patients when they were demanding antibiotic descriptions, looking at toolkits and frameworks, all of this stuff. So really kind of system-wide program of work. And what we've seen since that started in August 2023 until I think it was March 25 is now we're the 63rd highest in the country. So we've gone from 106 right down, real focus. There's still a few practices that we're working with where the levels are higher than we would want to be, but that's one of the ones that I'm most proud of. And what we've seen is that the rates of our healthcare acquired infections really drop as well. So that's brilliant. But the other two that I just wanted to touch on was Greater Manchester has a program of work around, it's very glamorous, infant male circumcision. So we know that there's communities that part of their practice is to circumcise their baby boys when they're born. And what we knew there's very little regulation around this practice. And in Greater Manchester, I think from 2010, 11, 12, we were seeing numbers of boys being missed to our hospital. And it's either high levels of infection or bleeds. They're really pretty poorly. And that was due to poor practice in the community. Kind of trained, unregulated practitioners who were kind of pitching up in places and circumcising little boys with, very little standards. So, and there was a death of a young boy as well, I think in 2009 in Greater Manchester. So the public health community kind of came around this, led by Eleanor Road at Greater Manchester, who's now retired. So myself and another consultant kind of developed the programme. But it's got its own website. It's funded through NHS money. So it's kind of split into two programmes. One is around supporting the providers. So these are often their GPs that out of hours they will do circumcisions, but they do them within their practice. So it's about working with them, ensuring that they're meeting certain standards and kind of building a network as well, so they've got peers to learn from. And then every year we audit their practice, so we have a set of standards, audit their practice, and if they meet the standards, they are then put on a website. So the website is a parental website. So parents can access information about circumcision, because what we were hearing was that families didn't know where to go, didn't know what to expect, and there's a lot of anxiety, and didn't know how to manage the site, the kind of complications as well. So we have a parental website. So what we've seen from that programme of work is that the number of boys admitted to hospital with complications has reduced as well. So really important. And then my final bit, is just around Trafford and our walking, reading and cycling. So we won Best Active Travel Council this year. Do a huge amount around school streets, around cycling and walking. And it's a real kind of culture in Trafford. So I think kind of being part of that leadership team there as well. So sorry, I couldn't just give you one out of the three.
No, it's great. And it certainly is evident that you've got a real good understanding of the community you serve, which is, brilliant. And, even some of those, smaller niche initiatives, must have so much benefit to the community. So it's great to get through. I'm sure you've got plenty more you could share. Just going on to the Greater Manchester stuff then, one thing I've noticed, and I know we spoke about it previously, is just how well connected you and the other DPHs in the region are. Can you explain a little bit about that network, how it got established, and all the benefits that you were gaining from that?
So we have just kind of relaunched it a little bit. So it's the Greater Manchester Public Health Network. So at the centre, it's 10 DPHs. Then it's kind of like an onion. I hate to use the onion because everyone uses onion. But then the layer around it is the population health team at Greater Manchester, OHID, opposite UXA, and other kind of academic partners as well, and our public health team. So we work very closely. The DPHs and population health team meet every fortnight, and we have 6 monthly away days, so we all get together and do some shared learning. I think Greater Manchester has worked well for a long time. They've always had strong partnerships within public health. I think it's because there's a real kind of shared need to address some of the enduring health inequalities that Greater Manchester experiences. Life expectancy is worse in Greater Manchester, for example, poverty, deprivation and inequality. So we've got that kind of shared ambition there as well. But with devolution, and looking back at our devolution journey over 10 years, that kind of strengthened us as well. There's been a lot of change within the public health community. I think after the pandemic, a lot of people moved on and retired. So the DPH, the Greater Manchester, now 10 of us, I think the longest in post has been about 3 years all year. So we're all pretty new. But but it helps us, I think, as a community to have that shared voice, and we have space to listen to each other as well. So that's, I think, in terms of partnership, it's been really, that's one of the strengths of having that DPH relationship, but also the devolution element as well. So making sure we're in the right places and talking to the right people as well. So the GMCA, at the moment, there's a huge program of work called Live Well, which is about making sure we have services in the right places, in the communities at the right time. So looking at Live Well spaces and faces and offer, but the core element of that is around prevention. So all of DPH is very heavily involved in that as well. So we have a number of shared programs. But I would say, so that the relationship started a long time ago, before any of the DPHs were in post-mail. In the pandemic, it really ramped up. I would say it gave us that real strength. In the pandemic, we just managed to mobilise ourselves really quickly and have some of those difficult conversations that others were struggling with because we knew each other. And then post-pandemic, it's kind of settled down, and we've realised that actually we need each other as well. So, it's hard to describe it, but I think we're really fortunate in Greater Manchester to have the level of partnership rating that we do have. And again, I think it's important to recognise it's not an echo chamber. We challenge each other, we learn from each other, we put ourselves into uncomfortable positions, but, it comes out as the real strength of Greater Manchester.
Yeah, absolutely. I think, working all over the country in the role I do, it's something that has been really evident to me. And I know we've spoken about it, but also other DPHs within the network have had conversations with the team at Panoramic. And yeah, it's always something that's been highlighted. So it's really nice to hear you talk about it so positively. What advice would you have for other directors throughout the country who are perhaps looking at doing something similar? How would they go about establishing that network?
So obviously with the devolution white paper, there's a lot of discussions going on amongst TKHs. I think it is about building those relationships. So kind of that listening to others, getting that shared understanding of what you're trying to achieve, but actually having those conversations, going out and meeting people, but also kind of thinking about our sphere of influence as well in public health. So what can public health affect? What can't we affect? And being really clear on where we should be in the system. So with all the different changing landscapes, I think at times it's been quite difficult to know where we should be, or finding out that actually why are we not in that ring? And it takes a bit of tenacity to get on those invite lists. So I think sitting collectively as a group of DKHs and thinking about your tactics and your approach is one of those things. I think, but also being clear on the role of public health in the system as well, and what our strengths are. Try not to dilute it too much, but really thinking about prevention, the importance of prevention, but being able to articulate what that means as well, because things can get lost when we do a lot of kind of strategic blue sky thinking. So it's using strengths, public health, and the principles and the frameworks to develop those partnerships and relationships going forward.
Brilliant. And yeah, I'm sure so many will benefit from hearing that. One kind of final thing I wanted to discuss, obviously you're a recent DPH, if you've kind of made us aware. What advice would you have for those that are either aspiring to be a DPH in the next couple of years, or those consultants who are perhaps a little bit wary of becoming DPH? Because as you all know, there are quite a few consultants that perhaps do have that fear of becoming a DPH till the role changes. What advice would you have for those people?
My first bit of advice is to do the aspiring directors. I think it's called the aspiring leaders now at University of Birmingham. So I did that 2 years ago, and it's brilliant. It's fabulous. The things you learn. It was led by it was Caroline Wilkington. I did it, and it was just brilliant. In terms of kind of the tools you're given, the conversations you have, it really kind of helps you kind of reflect and question your skill set. But also the networks you develop as well. In terms of, I think you have to feel. Sounds very cliche, but you have to be ready, because it is a tough job. I have 2 children as well, so it's kind of trying to get that balance of being a parent, but also being a leader as well, and public health. Sometimes it is about continually beating that drum in every meeting you go into. So being kind of quite willing to sometimes leave it. Well, it's advocacy, isn't it? But saying stuff that other people may not want to say or hear as well. So I think you have to be ready for it. Do the training, kind of use your networks, I would say. So I often speak to other DPHs and colleagues, people who've retired as well. So Eleanor Oakey was my DPH before I was, and other colleagues, always kind of reaching out to them and asking them for their opinion. I'd also say about kind of using the ADPH network as well. So those meetings, those monthly meetings are invaluable. Just kind of hearing that actually you're not alone, or if you're feeling frustrated, or also learning about all the positive stuff coming through. There's some really kind of inspiring people working as other DPHs, so to kind of learn from them as well. But I would say if you feel like you're ready, and only you will know that you're ready, then do go for it, because it's a brilliant job, and I love being DPH.
Great, brilliant. Thank you for that. Well, look, I think that concludes today's episode. Thank you so much, Helen, for your time. It's been great to have you as the first guest on season 2. Please stay tuned for more episodes.